Hello, everyone. Thank you for joining to today's call. So, which is basically a clinical conversation, which is part of the G Healthcare webinar series. As G, we are serving patients and providers for more than 100 years, and G Healthcare is advancing personalized, connected, and compassionate care while simplifying the patient's journey across the care pathway. And this is why we have a high focus on the dose excellence, namely dose watch technology, which is helping to ensure optimized lowest dose with a solution that automates oversight, identifies opportunities for improvement, and sound alerts to mitigate and eliminate issues. Using this solution helps elevate staff from the complexity and worry that come with the dose management. And it helps empower confidence in your staff that you are delivering quality care, but with less effort and also improved accuracy. And today, with this perspective, Hacettepe University and GE Healthcare have partnered to utilize those watchers, dose tracking and monitoring software to deliver outcomes. Our partnership has been ongoing since early 2019, and this webinar is intended to showcase the benefits and as well as the outcomes which we expected by implementing the dose excellence program, which was led also by Professor Mehmet Ruhi Onur, whom I wish to thank and introduce. Professor Onur, the floor is yours. Thank you.
Okay, thank you very much for this introduction. I also thank to the all audiences to join this webinar. I am Dr. Mehmet Ruhi Onur from Hacettepe University, Faculty of Medicine, Department of Radiology. In this webinar, I will give information about the Dose Excellence Program and its benefits for radiology. This presentation will include some sections. It's comprised of the information about the dose management system and how dose management system works. I will also give information about the general insights on the requirements of having a dose monitoring, standardization, and optimization system. At the last section, I want to mention about the dose watch system in our radiology department with the following subtitles as the implementation of this software to our department and the initial assessment of our department by the dose watch system, the dose management challenge that we faced in our department and how did dose watch help us to overcome this challenge. Also, I will summarize the best practices that we achieved with dose watch system in our department. And if we have a time, I will also mention about the future directions of our department with a dose management system. So the first question is what is dose management system and how it works? Dose management systems collects and extracts the radiation dose data from the radiology department's softwares. And also these systems monitorize this data and analyzes this huge data. This data is helpful for standardization and optimization of the imaging protocols and our routine practice also. And also they allow us, these dose management systems allow us to benchmark our data with our institution's data. To do these tasks, dose management systems automatically collects the radiation dose from the imaging devices and or the PAC system of the departments. And the DICOM form is used for the data, and also data can be collected regardless of the medical imaging equipments or the manufacturers, the hospital subunits. Imaging equipments can be included in these dose management systems are the CT scanners most frequently, also radiography systems, fluoroscopy systems, mammographies, and surgical mobile C-arms, interventional radiology systems, and all cardiovascular imaging systems also can be included in the dose management systems. The main data in dose management systems used is the radiation dose related data. So we can divide the radiation dose related data into two main sections. such as the demographic data of patients and also exam information, which includes the gender, age, weight, height, and the patient effective diameter, and also body mass index information of the patient. These all comprise the demographic data of the patients. And also the exam information in radiation dose related data is the exam date and time. Also protocol name, co-transit administration, and device name can be included in the exam information. The main dose related data in dose management systems is the quantitative dose values and the dose product values, which are the computed tomography dose index value and dose length product value, size specific dose estimate value, effective dose, and average glandular dose for mammography, and dose area product for radiography and radiofluoroscopy. Also, we can extract and analyze cumulative dose of the patients. Also, we can get information about the exam positioning parameters, such as the isocentering of the patient, also the scanning range of the imaging examinations. We can see these information on the dose management system, and also exam acquisition parameters, which are very important to have the radiation dose product value, such as the tube potential or tube current, and other exam acquisition parameters can be seen on the dose management systems. After collecting the dose data from the department softwares, dose management systems analyze these huge data, the number, type, and dose values of the examinations performed per patient, device, protocol, and the time period, and also per technologies can be analyzed. And some results can be get from these analyses, such as the change in the number of examinations done per year or per month, and also the comparison of patient level, device level, and department level data can be made. And the very important aspect of these dose management systems is they are very helpful for to set the protocol specific diagnostic reference levels that many of the radiology departments need these to establish. The other section of this webinar is the general insights on the requirements of having a dose monitoring, standardization, and optimization system. The main question is why radiology departments need dose management system. All radiology departments have a huge data, dose-related data, because in daily routine practice, we perform a lot of imaging examinations, radiographies, fluoroscopies, and computed tomographies, and interventional radiology examinations also. So we have a big data, but we should monitorize these data, and also for monitorization of this data, we need some softwares which extract all data and also analyzes it. Also, it is important to be aware of the high dose alerts, and also collecting and monitorization is not enough for the radiology departments. We should analyze the all extracted data, dose related data. Extracting the data and analyzing this data is not enough also. After analysis of these results, we should discuss the results of the data, and also to optimize our imaging techniques. Sometimes patients as well as clinicians need to know about the radiation dose performed, radiation dose of the examinations performed on the patient. So if we want to give information about the radiation dose of an examination, we can get the information, radiation dose information from these dose management systems. Radiology departments also should be incompatible with the criteria of some international radiation dose regulations and criteria, such as European Directive Basic Safety Standards criteria. So to be compatible with this criteria, radiation departments need the dose management softwares. If you want to benchmark our results, the results of the analysis, our data with the other institutes, we also need the dose management systems to get the all data, to get the results of the all analysis, to benchmark our results. Also, if you want to do research studies about the radiation dose values, and we need some softwares which give us the analysis results of the big data. So because of all these reasons, radiology departments need the dose management systems. So we implemented a dose management system as the dose watch system in our radiology department in Hacettepe University. I want to summarize the journey of the dose management system in our department. First, after the implementation of the software in our department, we included some imaging techniques, modalities in the system, and we configured a radiation dose team, and that's recommended by our dose management system. After the implementation of the software, our department was assessed by the dose watch system. This was the initial assessment to take a photo, the big photo of our department's radiation safety issues. And this was the initial assessment. And also they analyzed our results of the initial assessment. So we together determined the key performance indicators for radiation safety. And we did organize the regular meetings. And in these meetings, we discussed the results of the analysis of the assessments, the repeating assessments also. And we compared the results of the different assessment periods with dose management system in our department. Implemented devices in our department in dose watch system includes the computed tomography devices, the radiographies, mammographies, and some interventional imaging units. But we started from first computed tomographies, then we added radiography and fluoroscopy also, the mammography and the other units. The radiation dose team in our department also had a chance to control the dose management system with their own computers with remote control. And all the team members were educated to use dose watch software also. The dose team in our department was comprised of the radiologist and radiation technologist, medical physicist, and the information technologist. So we all analyzed the results of the dose watch analysis information data. The initial assessment presented us the state of the imaging studies in our department. The demographic data of the patients were obtained in the first initial assessment, and the number, type, and the distribution of the CT protocols in our department were defined, and the number of exams per patient also, such as here, with some graphics and bar charts. We saw the big photo of our department. We saw the activity of the CT equipments and those values of each CT protocols and mean values and the maximum and minimum values we learned. After the assessment of the initial findings, we defined the major drawbacks about radiation safety. And in the subsequent assessments, we did some improvements in the time period after the regular meetings, after discussing the results of the analysis. So for example, in this bar chart, we see the number of exams by patient. For example, this number of patients underwent only one CT examination, and this number of patients underwent the 2 CT examination in the time period. And this also graphic shows the activity of the CT equipments in our department. Each color code represents a different CT scanner So we can see from here the heterogeneity of the workload of the different CT scanners. So those management systems can demonstrate the all imaging data with the quantitative values and also by graphics. So it is very easy to see the present status of the imaging examinations and the number and the activity, all the numbers and the results and analysis very easily by these dose management systems. As demographic data, we can see the age, gender, weight, height, and the body mass index of the patients who underwent imaging examinations in the radiology department. The first assessment of our department's analysis interestingly showed us that the 88% of the patients, the body mass index of the patients, 88%, was not recorded in our department. So only 12% of patients, the body mass index of only 12% of patients was recorded. That was unacceptable. After implementing the dose watch system, 3 months later, we can see the change here. The 95% of the patients, the body mass index of these patients were recorded. So after the initial assessment, dose watch system showed us the drawback about this situation. So we educated our CT technologists. We set them to record the body mass index of the patients, and then we can see the change in this context. Another issue is the justification of those alerts. It is very important to be aware of the high dose alert in the imaging examinations, and also as well as we should, it is very important to justify the dose alerts. So in the first initial assessment of our department by dose watch management system, we can see high dose alerts were not justified by CT technologies. So we have 2,905 CT examinations here. Only two of 182 CT examinations with high dose alerts were justified. So this is very small percentage of the all CT examinations, below than 1%. After dose watch implementation, we can see that the 77% of the high dose alerts were justified by the CT technologies. That means that these examination was with high dose, but the reason of this high dose was, for example, attributed to the high body mass index of the patient. So if we write this on the CT record, it means that we justify the dose alert. If we don't write anything, it means that we didn't justify this dose alert. So dose watch also helped us to increase our justifying percentage of high dose alerts. Dose watch also can show in which days we see the high dose alerts in our department, also in which protocols, CT protocols, or how many dose alerts are justified according to the CT technologies. So we can compare each parameters as the CT protocol, CT technologies, and the weekday or the daytime for justifying the high dose alerts. So in these bar charts, we can see the high dose alerts and the CT technologies. Justification of those alerts may depend on CT technologies, we know. So dose watch enables departments to monitorize the justification performance of the CT technologies. This is the results of the initial analysis of dose watch in terms of the alerts justification by technologies. So in the first month, we can see that the only 2 CT technologies contributed to the justification of high dose alert. But after dose watch implementation, 3 months later, we can see here that the number of the CT technologies who justify the high dose alerts are increased, and also the percentage of the justification of the high dose alerts also increased, which is shown by the yellow color here. In the first initial assessment, we don't see any yellow color here. That means that there is no justification of high dose alert. But in the other bar chart, we can see the yellow codes. So that means that the justification of the alert is started. CT protocols with high dose alerts and justification percentage of those alerts according to the CT protocols can also be seen on DoseWatch system. This is the initial assessment results. We can see the not justified alert with red colors and the justified alert with yellow colors in the initial assessment according to the CT protocols. And after the evaluation, after the DoseWatch implementation, we can see the percentage of the red color is decreased and the percentage of the yellow color is increased, which means that the percentage of the high dose is decreased. And if we see any high dose, the CT technologies justify these high dose alerts. So it is very important to know the reason of the high dose alert, but we need CT technologies to justify to these alerts. So by justifying these alerts, we can know the reason of the high dose, so we can solve the problem about the high dose CT examinations. DoseWatch also shows the CT activity in the activity of the CT technologies in the department. This is the beginning of the DoseWatch system in our department, so we can see the distribution of activity by technologies. In this bar chart, we can see the two of the technologies is very active, but the others are not so active. But after implementing the DoseWatch system, everybody knows that all the information is monitorized. So after DoseWatch system, we can see the activity of the CT technologies is more homogenized and the workload is divided between the CT technologies more equally. So also it is very important for radiology departments to increase the activity of the CT technologies as well as dividing the workload equally between the CT technologies. Extracting and analyzing data is not enough. One of the most important duties of radiology departments is standardization of the imaging protocols also. Standardization of the CT protocols refers to a concept that a CT protocol defined in a radiology department should be performed with almost same exam acquisition parameters and number of imaging sequences. So some radiology departments may have the standardized imaging protocols which include the equal number of the imaging sequences and also the same acquisition parameters. Some protocols may have the heterogeneous imaging sequences and the parameters. So this should be standardized. Our initial assessments revealed that our unstandardized imaging protocol percentage CT protocol percentage was 14%. After DoseWatch implementation, this number decreased to 7%. It was the 50% decrease we achieved in standardization of the CT protocols. So this was better than the initial status. And also lexicon mapping is essential for departments to standardize the imaging protocols, because the lexicon mapping, by lexicon mapping, we can match the CT protocol names, the appropriate lexicon codes, and CT protocols names may differ according to different CT equipments, which makes monitorization, comparison, and the analysis of those data difficult. And lexicon mapping of CT protocol names standardize the CT protocol names and enables the departments to benchmark their data with other departments. And after dose watch lexicon mapping, we can see here from this graphics that the CT protocols in our department, lexicon mapping of CT protocols increased from 5% to decreased from the unstandardized lexicon mapping from 31% to 5%. So after implementation of the dose watch system, 95% of our department imaging CT protocols were matched with the appropriate lexicon element mapping. Dose watch may also monitorize the CT protocols in terms of matching with the lexicon, appropriate lexicon codes such as the RADLEX or the other Loing lexicon maps. So standardization of the number of sequences in the CT protocols may also be interrogated with the dose watch. So dose watch here shows the standard and unstandard CT protocols. Standard means including the same number of the imaging sequences in the CT protocol. After dose watch implementation, we can see the change here. So the red color-coded areas are decreased, the number and the number of the red coded areas decreased, means that the CT protocols had more homogeneous number of imaging sequences. Dose watch demonstrate some dose reduction tools in our CT protocols. For example, in this bar chart, we can see dose watch reveals the distribution of exams that use iterative reconstruction algorithm per protocol. So we can see from here that in some protocols, our department use the iterative reconstruction algorithm, and in some protocols, we don't use in the initial assessment. So it gives us, dose watch gives us opportunity to revise our protocols if we want to use some dose reduction tools. Trending of radiation dose indices by lexicon elements, it's a very important aspect of this dose watch system, because in this graphic we can see the head CT protocol and the dose trend of head CT protocol. It means that in this various months of the different months in a year, we can see the dose trend of the head CT protocol in terms of the CTDI volume, dose product, or dose length product. So this graphic has a lot of information. We can see from here that from this image, we can extract a lot of dose values, which means we can see the median value and the mean value, maximum value, and some dose values above the 75th quartile range, and some dose values also below the 25th quartile range, and also the minimum value of these CT protocols. So if we see any variation in this trend, dose watch system shows us the difference between the months in terms of the CT protocol dose indices. So this is another example for chest CT. Here we can see the trend of those indices in the chest CT. And also, if we see any variation, such as here, this means that the mean value of this chest CT in the July of this year is increased. So dose watch shows us there is a problem here. It makes easy to see the problem, the high dose here. So we can solve this problem. First, we should find the reason why mean dose value is increased in this month, and then we can find the reason also with the help of dose watch system. Dose watch also may give information with graphics. This is the line chart also that compares not only those product the results of those product values. dose watch also can give some graphics which includes the dose values, also the number of the examinations. So in this line chart, we can see that the number of examinations, this is the head CT examination, the number of examinations is increased, but the dose of the head CT is stable. So it means that although the numbers of the head CT examination increased, we can see the dose is stable, which means that the dose protocol, the protocol of this CT examination is good and didn't change even in the increase of the CT examination number. But this is another example. This is the chest CT. So we can see the number of the chest CT examination is increased in this time period, but the trend of the dose product is varied. So this is a problem. So the dose is increased and decreased, and so we can see an increase here in some months. So this needs to be explained. This needs to be interrogated in detail, why dose is decreased or increased in the CT protocol. So those what shows us the main problem, and also helps us to solve this problem in the way that I will show in the next slides. We can have a lot of information about those results of the CT or other imaging protocols, such as the mean values, median values, and the quartile values, which can be used in the establishment of the diagnostic reference levels of an institute. And also in dose watch system, we can compare the mean or median or the quartile values of those radiation dose with the European DRL values or other DRL values that's recorded in the dose management system. So as I mentioned before, dose watch shows us the main problems about the radiation dose safety in our department, and also it helps us to solve these problems. How it helps us? Because dose watch also show the tail of the problems in imaging examinations. For example, we all know that the patient positioning in the CT gantry is a very important issue in dose optimization. The patient should be in the center of the CT gantry, but if a patient is settled in the lower part or in the upper part of the CT gantry, the radiation dose will increase. Dose watch has opportunity to show us the positioning of the patient for each imaging examination, for CT, for each CT examination. So if we see a high dose in an examination, see that the optimal positioning of the patient in the CT gantry should be as this, in the center of the CT gantry. But in this examination, we can say that the patient is improperly positioned in the lateral axis. The deviation of the patient was approximately 3 centimeters, which increased the radiation dose of the patient. Also demonstrate the whole photo CT protocols in terms of the improper positioning of the patients. So as I mentioned before, we can have information about each CT examination, and also we can have information about the whole examinations that are included on the CT protocols. So these bar chart also shows us the frequency of non-isocentricity, the frequency of improper positioning in different CT protocols in dose watch system. So you can see in some protocols, such as the cardiac CT, or this is the abdomen CT, is the kidney protocol, we can see the improper positioning percentage ratio is very high, so which need to be corrected. Dose watch also can show can give information about the other CT acquisition parameter, which is the scanning area, which is very important for the CT dose. In our department, with the help of dose watch, because we extracted all the data from the dose watch, we conducted a research study, and we found that the overscanning in the z-axis in all CT examinations we included in this study were 66%. So overscanning, we know that results in the high radiation dose. So dose watch can show also the percentage of the overscanning in a department for each CT protocol or for all CT protocols, and for each CT examination, dose watch can show the scanning area in the CT examinations, as in this image shows the optimal scanning area for head CT, for example. But in this patient, we can see this is a head CT also, but the scanning area in the lower part of the image is higher than the optimal scanning area. So this will cause the high dose, and this problem can be detected with the dose watch. After having information about the whole CT protocols and also the mean values such as that, and also the CT acquisition parameters, we have a lot of those reports in the dose watch system, which includes the mean and median values and the other quantitative values, the imaging protocols. We can have those values in different time periods, and also we can compare the CT equipments and CT technologies also in terms of those product values. And this is the analysis results also. For example, in this analysis, we can compare the different CT equipments. This is the Optima CT, and this is another Optima CT in terms of the head CT. So we see that this equipment has a higher head CT DLP dose than this CT equipment. So this should be examined in detail why this dose is higher than this one. And also we know that DRL values, diagnostic reference level values, can be obtained in terms of the CT protocols, and as well as in the recent years, it is emphasized that clinical indication-based DRL values are very also important. In our department, after dose watch implementation, since we matched our CT protocol names with the appropriate lexicon mapping codes, we had chance to extract those values of the different clinical indications. So we can, for example, have the clinical-based DRL values for each clinical indication. So this is an important advantage of dose management systems also. So by matching the correct lexicon mapping with the department's CT protocol names, dose watch enables us to compare all the CT protocols in different time periods, and so we can have information about the variability of the dose values even in the same CT equipments in the different time periods. Dose watch doesn't include only the computed tomography. Also, as I mentioned in my first slides, we can implement the mammography and the average dose values of the mammography. Those products of the mammography technique can be monitored in the dose watch system, as well as the radiography and the fluoroscopy. And those product values are represented as dose area product in this dose management system. We can also monitorize and analyze the dose values of the mammography and radiography, fluoroscopy, as well as the interventional imaging units. Imaging Insights is another tool of GE, which is very helpful, and established in our department. Imaging Insights is a software that analyzes the workflow of the department as well as the radiation dose product values and radiation dose parameters. So we can see here that the Imaging Insights examines and analyzes the CT examinations in detail, not only protocol. We can see the all imaging sequences of the CT examinations in Imaging Insights, the number of the each CT protocols, the number of the each CT examinations, and the number of the each imaging series of the each CT examinations we can see, and also duration of the each CT imaging sequences can be seen on this graphic. The Imaging Insights enables us to see the whole photograph, not only the radiation dose values, but also the workflow of this imaging units. We can extract the information from the Imaging Insights. And also Imaging Insights analyzes the imaging protocols with high detail. For example, we can see from here that some imaging series of the CT protocols have different doses, and Imaging Insights show us the imaging acquisition parameters of these different imaging protocols. And from here we can see that this protocol has lower CTDI volume than this CT protocol, but Imaging Insights show us that the lower dose CT protocol had a higher iterative reconstruction algorithm, as well as the lower tube current value, so which lowered the radiation dose here. So Imaging Insights show us not only the problem, but also the reason of the problem we can see on the Imaging Insights software. So the take-home message of this webinar may be radiation departments have enormous data from imaging devices that have, and they need to monitorize and analyze their data for standardization and optimization of their imaging techniques. And they should use dose reduction strategies to optimize their imaging techniques. Dose management systems are very helpful for the needs of the radiology departments because they cover all imaging modalities regardless of the manufacturers. They extract the all data and categorize these data for the monitorization, and then dose management systems and Dose Watch also analyzes the data for detecting the drawbacks in imaging acquisition protocols and parameters, and dose management systems reveal opportunities for overcoming the obstacles in optimization of dose management. They also enable departments for benchmarking their data and their results with other institutes. And the very important aspect of this is dose management systems. They provide quantitative data for radiation dose-related research studies that we perform in our department. This is the end of my presentation. So I will be happy to get your questions and answer them. So this is a question here. On the 13th slide, the audience asked that they observe that mean DRL is lower than the European DRL values. How can you maintain low dose while retaining high image quality? Is there a feature to distinguish high image quality? This is a very good question, first of all, because lowering the radiation dose is not the only thing in dose management of the radiology departments. It is very important to achieve the image quality in a standard way, to protect the image quality in the setting of the lowering the radiation dose. Yes, we have some low DRL values than the European levels, but in some protocols we have high DRL values. We routinely observe our image qualities in our CT protocols, and we have a team which regularly scores our CT imaging examinations in terms of the parameters of each CT protocol, such as head CT, chest CT, or abdomen CT. So after scoring of the all CT examinations, we sometimes make change of the CT acquisition parameters, which may lower or increase the radiation dose of the studies. For example, I can give an example for head CT. After dose watch implementation, we lowered our tube voltage in head CT examinations from 130 to 110. So 110 kilovolt was appropriate for us to preserve high image quality and to lower radiation dose. But we observed that in trauma patients who are with trauma table, 110 kilovolt wasn't enough for the head CT examinations. In those patients, we increased the tube voltage to the 130, which preserved the image quality, and also the dose was higher, but the most important thing to preserve the high image quality. The other question I want to respond, is there any study recommended that using dose watch may aid prolonging the tube age? I didn't see any study about CT tube age or other radiography systems tube age related with using the dose management systems. But it sounds good, and that can be achieved because dose management systems help radiology departments to optimize their imaging examinations. So in my point of view, usually optimizing the imaging examinations in radiology departments results in more appropriate utility of the acquisition parameters of imaging examinations. So we know that the tube of all imaging devices can be more lengthened with the optimization of the acquisition parameters. So those management system, I think, will be helpful also to get the optimized tube lifetime, also by optimizing the acquisition parameters of each examination. The other question is what was the biggest outcome of implementing dose watch? Yeah, I think the biggest outcome was initially to see the whole photograph of the department about the radiation safety, in terms of the radiation safety, because we saw the where we are in the, for example, in some protocols, CT protocols. We compared ourselves with other departments that were included in the dose watch also. So I think the biggest outcome to get the information of the present status of the department. And also the other biggest outcome was to see the change in the time period after dose watch implementation with optimization steps. First we saw the initial assessment results, and we saw the problems. So we discussed in our regular meetings the problems and the potential solution methods for solving these problems. And after 3 months later, after 6 months later, we had the regular meetings. By the way, we also had the monthly report every month we got the report from the dose watch team about the status of our department. It was approximately 100-page each report, and each report included all CT protocols with all those product values. So in the regular meetings, following regular meetings, we saw the change in our department, lowering those, and we solved some of the problems are solved. So this was the other outcome also. And Rochelle Labios, also the other audience asked, it is safe for cancer patients to do a CT scan of the neck, chest, abdomen, and pelvis, even though we know that CT scan exposure only carries a small risk of giving cancer to normal patients. What about the cancer patient? In oncology patients, we know that cancer patients are not independent of the dose radiation dose related results. So we do not act differently in cancer patients with the other normal population in terms of dose reduction technologies. So the first issue for the radiology departments is to preserve the image quality first. And with the preserving image quality, we only do something about those acquisition parameters, imaging acquisition parameters, to lower radiation dose, but not with lowering the image quality. So we know that the cancer patients undergo a lot of CT examinations, and these also increase the risk of the potential cancer occurrences in these patients, but lowering the radiation dose in these patients may also cause the lowering the image quality. But the important issue of the dose management system in these patients may be the cumulative radiation dose is very important. So those management systems give information about the cumulative dose in all patients. So this may be important for some cancer studies also. Another question is how did DoseWatch contribute to global accreditation standards? Yes, DoseWatch was very helpful for our department to be in the accreditation of some regulatory bodies. For example, our department have a Eurosafe Imaging Star 5-star. So Eurosafe Imaging and some regulatory bodies in radiation safety had a lot of criteria. And one of the main criteria in these regulatory bodies is having a dose management system, because these regulatory bodies want us a lot of dose data information, which we can only get from the dose management system softwares. For example, the mean dose of CT protocols and the cumulative of some patients, and the number of patients with highest cumulative dose, such as these data can be only extracted dose management softwares. So we got our Eurosafe Imaging Star with the help of the dose management systems that we have in our department. So they are very helpful for the accreditation of the radiology departments. Another question, are there any modifications or additions that you would make now that you are looking back at the data? What is next for the program? Yes, we have a lot of duties to do with also DoseWatch now, because we have some drawbacks also in our department. We didn't standardize yet all the imaging protocols in terms of the number of imaging sequences, and also we are not at the highest 100%, as well as in the lexicon mapping also. So these are the duties that we should do. The standardization, the ideal percentage ratio of the standardization of the imaging protocols, names of the protocols, number of imaging sequences, as well as the acquisition parameters of the imaging protocols should be approximately the same. So this is very important for analyzing the data in the radiology department. Also, it is very important to match all CT protocol names with the appropriate lexicon mapping for benchmarking of the radiology departments with other radiology departments. So we are not in the 100% now, which are our duties in the future that those watch will help us. One more question is from the audience. What is the source of the data? I might have missed that part. Is it provided by CT technologists or the system directly? Yeah. Those management systems can get data, some of them from the PAC system, some of them from the imaging device directly. So those watch extract the data from both the PAC system and directly from the imaging equipments. So I think it is very important to get the information from the CT equipment directly, because some data after the CT examinations may not be sent from the CT device to the PAC system. So that means that some data may be missed on the PAC system. So those management systems which get the data from, extract the data from directly from the imaging devices, I think more helpful for radiology departments in analyzing the whole data. And the other questions is how can establish the key performance indicators by those watch? Yes, this is a very good question. Also other like other questions. I will give an example. For example, after our initial assessment, the dose watch team established the key performance indicators, which were, for example, the recording of the body mass index values of the patients, and also standardization of the protocols and the appropriate matching of the CT protocols with lexical mapping codes, and also using the pediatric CT protocols for pediatric patients. So these were the examples of the key performance indicators. Key performance indicators means that some issues in the departments should be corrected, you know. For example, I showed in my presentation the body mass index information of the patients was not recorded in our department. It was below the 1%, but after dose watch implementation, it increased to 77%. And also standardization of the CT protocols, the percentages increased. So these were the key performance indicators, and first established for our department. And these means that these were the targets to be corrected. And after dose watch implementation, we solved the problem with the quantitative values, you know. We saw the percentages, we saw the numbers, and we showed these numbers and values to our CT technologists and other radiologists. And we discussed these results, and we analyzed the results of the all data. Then we corrected some behaviors, and so we did some achievements in these key performance indicators. Is the patient dose can be documented with the help of a dose management system? Yes, exactly. Dose management systems and dose watch also can give a very nice dose report, including the cumulative dose and each radiation dose product value of each imaging examination, including the CT or other imaging examination with ionizing radiation. And those data of these all imaging examinations are included in the dose report of the dose watch with the cumulative radiation dose. And also those products, those values are represented with effective dose values in the dose watch, dose reports data. Is it true that radiations, the other question, is it true that the radiations of low frequency does great damage to human body than that of high frequency? This is not about the dose management system, but in our general information about the radiation safety, we know that the high frequency radiation is more harmful than low frequency radiation. So the frequency of the radiation that determines the type of the radiating energies. So the high frequency energies such as the cosmic waves and the X-rays and also gamma rays are the harmful for the bodies, that are the ionizing radiation. Why they are ionizing radiation? They are with high frequency. So in my opinion, the high frequency, to the best of my knowledge, high frequency energies are more harmful than the low frequency energies. So these were the all questions that I answered. I think there is no other question. And thank you for joining to this webinar again. I'm pleased to give this webinar, and thank you for all your questions and answers, and thank you GE for giving opportunity me to present this webinar.